Hello and thank you for joining me today. I'm going to be speaking about a condition called Takayasu arteritis. What did you just say? Yes, Takayasu arteritis. Clearly, that first word is not an English word. Takayasu is actually um, a Japanese word, so don't be surprised. It sounds very foreign. So it's not an English word. Takayasu. Arthritis, not arthritis. Arthritis. I've made some videos about arthritis and I encourage you to watch them. Arthritis is pain and swelling in a joint, but here we're discussing arthritis, which is of with respect to inflammation of the blood vessel. And so, Takayasu arthritis is a form of vasculitis, which is inflammation of a blood vessel. So, I've done another video concerning giant cell arthritis, which is another form of vasculitis. I encourage you to watch that as well. The inflammation that occurs does so in a large artery called the aorta and the branches and its main branches. The aorta is the biggest, is the largest artery in the body, so you can imagine that anything that affects the artery will definitely have obvious consequences in the body. Essentially, what this inflammation does is that it could narrow a blood vessel, in which case we call that stenosis. It could actually block the blood vessel, which we call occlusion, and it could also weaken the artery, the walls of the artery, making the artery to bulge, what we call aneurysm. Now, if a blood vessel has been weakened to that point where it bulges, then there is a tendency it could tear. Who is Takayasu arthritis likely to affect? It most likely would happen in a patient that is of Asian origin, usually a woman, that is a lady that is less than 40 years of age. Now, in medicine, we never say never. And so, even though this is the description of who Takayasu arthritis may affect, it could affect other people. I've seen just a very few number of patients with Takayasu arthritis, but remember, no knowledge is wasted. And so, if we're dealing with a form of inflammation that can affect major blood vessels like the aorta and its branches, it therefore means that the symptoms that could present in a patient could actually be quite a number. And this could include fatigue. Yes, we all do get tired, but when you notice undue fatigue, that is something that is worth mentioning. Unintended weight loss, muscle and joint pains and aches, mild fever. Some patients may have night sweats. There could be weakness or pain in the limbs with use. The pulse could be either weak or absent. Now, you notice that sometimes the doctor brings his hand close to your hand to check your pulse. Usually, we should be able to feel the radial pulse. There's a vessel, a blood vessel running through there called the radial artery. We should be able to feel it. If for some reason the doctor tries to do that, can't feel it, that's an important observation. So the pulse could either be weak or absent. And that's one of the reasons why Takayasu arthritis is also referred to as pulseless disease. Of course, there is a vessel, but we expect to feel the pulse. And so when we can't feel the pulse, so we say pulseless disease. It also results in dizziness, headache, stroke, chest pain, shortness of breath, high blood pressure, could result in anemia. So we're dealing with a condition that can present with so many symptoms. What does a doctor do in this situation? It's important for me to mention that one of the very quick things that could be that could trigger that thought that this could be Takayasu arthritis is a situation where you go to the hospital, you try to check your blood pressure in one arm, and for some reason you're unable to get that blood vessel, or the doctors are unable to get the blood vessel, get the blood pressure. The next thing is to try the other arm. Usually we should be able to get your blood pressure in one arm. If for any reason we are unable to get it in one arm and are able to get it in the other arm, that's an important observation. Number two, we expect within the certain range that the blood pressure in one arm shouldn't be much different from the blood pressure in the other arm. If for some reason the blood pressure in one arm is significantly different from the blood pressure in the other arm, one of the conditions that could present with that type of manifestation is Takayasu arthritis. So what does the doctor do? Doctor would take this history, look out for all the symptoms I've mentioned, and then do some blood tests, particularly inflammatory markers, what we call the C-reactive protein and the erythrocyte sedimentation rate. Typically, in a patient with Takayasu arthritis, remember I said that this is inflammation of the blood vessels, these values will be raised. The doctor will also go on to carry out some imaging studies to look out for these vascular abnormalities. What the doctor then do is to place the patient on treatment after making a diagnosis, and this treatment would vary from steroids, then a number of times will require immunosuppressants, and then if there are obvious vascular abnormalities that require surgical intervention, that will be carried out. So we've discussed the condition called Takayasu arthritis, which is a very rare disease, but it's important that we are at least aware that something like this could occur or does exist. And if you have blood pressure checked on one arm and they can't get the reading, please check the other arm, and it's an important practice to do from time to time. Thank you, and see you next time.